So AT-02 is an antibody that's fused to a peptide that's very similar to the imaging agent, and it binds to all forms of amyloid, ATTR, AL, and all the sort of rarer forms as well. And it's designed to be an opsonizing agent, which is when the antibody binds to the amyloid deposits through the interaction of these peptides with the amyloid, it can induce cell-mediated removal of those deposits. So the patient's own immune system contributes to the whole process. The antibody coats the amyloid. The immune cells recognize this signal. They come in, and through interactions with receptors on the macrophage cell surface, they become activated and they undergo this process called phagocytosis, where the amyloid is taken up and degraded and ultimately cleared. What's very nice about AT-02 is that its binding to amyloid is not dependent on what we call a cryptic epitope. These are epitopes that are normally sort of buried in the native state of TTR and light chains when they're in their sort of natural form. But when they form amyloid, they become apparent. AT-02 relies on this peptide, which is a pattern recognition peptide, and it can bind two things within all amyloid deposits. So we think that gives it an advantage. It allows it to bind throughout the amyloid and is not restricted by these perhaps rare and maybe hidden cryptic epitopes in the amyloid deposits. And then again, we rely on the immune system, which has been shown to be capable of removing amyloid when there's an antibody present upon it. So we're exploiting that sort of natural mechanism to get rid of amyloid. And with respect to the impact it can have, I think right now we all agree that preventing the amyloid precursor protein, the TTR or the light chain, from either being produced or being capable of forming amyloid is a great first step. It can slow the progression of the disease. It can stabilize the patients. And that's what we're seeing in TTR. We don't have that. We have that also in AL by attacking the cells that make the light chains. But I think what's really needed to improve organ function, potentially quality of life and overall survival for these patients is actually removing the amyloid from the tissues. Tissue damage caused by amyloid is phenomenal. And being able to remove that, allow the tissue to regenerate or to regain function is really important. So that's the goal that Atralis has. And I think AT-02 has the capability of being able to facilitate amyloid removal and ultimately impact all these parameters: organ function, overall survival, and quality of life. So AT-02 is being developed aggressively right now by Atralis. And the next step is that within the next half year, within the later half of this year, they'll initiate a phase 1 study in healthy volunteers and amyloid patients. So it'll actually go into a clinical evaluation later this year, which is really exciting. So we'll get some indication of what's going on there.